Hello, my name is Shelby Hale and I'm a senior at Warren County High School. I'm taking online speech at Motlow, and today I'll be talking about neonatal abstinence syndrome. This is my informative speech, and here's my audience. When the thought of newborn babies comes up, joy and happiness fills the room. Until it does not. Mothers find themselves hitting rock bottom, and drugs enter into the pregnancy. Drug abuse can affect many factors of a pregnancy. Some of these may be miscarriage, preterm labor, having the baby go through withdrawal symptoms, and a higher risk of sudden infant death. So what is NAS? NAS is neonatal abstinence syndrome. This is a medical disease or medical condition in which the baby has been exposed to opiates or drugs during the pregnancy. These drugs can be passed on to the unborn baby through the pregnancy. The baby can become dependent on the drugs after exposure, according to KidsCentralTN.com. Moving forward, so what happens to the baby after birth and after exposure? A baby that has become addicted will have withdrawal symptoms, much like an adult, just in baby form. Some of these symptoms may include body shakes, tremors, tight muscle tone, high or excessive crying, slow weight gain, poor feeding habits, and a fever, according to marchofdimes.org. In simple terms, the baby is uncomfortable and is unhappy. They continuously crave the stimulant that the mother also was getting during pregnancy. So how does healthcare change for a neonatal abstinence syndrome newborn? A baby going through detox will need extra care and attention. One change in the way they are cared for is every 1 to 4 hours, a nurse in the nursery will score the baby on the presence and intensity of the symptoms. Some of the things they look into are their central nervous system, respiratory system, and GI disturbance, or their stomach. If a baby scores 8 or above, the nursery is advised to wean the baby out of the addiction by pharmacological management. Pharmacological management is when a baby is sent off to a clinic or a bigger hospital that does this treatment, and they receive small amounts of morphine orally until they do not need it anymore. 50 to 80% of neonatal abstinence syndrome babies that have been exposed to opiates need pharmacological management, according to myamericannurse.com. Another way the babies are cared for differently is by extra holding, swaddling, rubbing, swaying, rocking to reduce external stimulation. All of the extra physical touch care plans help reduce the baby's anxiety and also help them relax. Concluding my point about neonatal abstinence syndrome, this is a medical condition in which the baby has been exposed to drugs during the pregnancy. Withdrawal symptoms may vary depending on the severity of the addiction, but most importantly, the baby is uncomfortable and unsatisfied. They're craving that stimulant just like the mother was. Physical touch will ease the baby's anxiety and help them relax. Over half of the cases need pharmacological management, meaning they have to be sent off to get morphine, just like their mother did. To help the baby out of the addiction without sudden death occurring, this is a necessary process to neonatal abstinence syndrome treatment. Thank you for listening to my speech, and this is my audience once again.